Okay, hello. My name is Shayna. I am a Shayna Seabrook. I'm sorry, and I'm a nursing student, FNP student at Claflin University. And this is going to be a neurological assessment video. I have here my volunteer, Kevin. Um, he's already consented to volunteering. Kevin, do you consent?
Yes, ma'am.
Okay, so Kevin has consented to volunteering for this video, and I've already washed and sanitized my hands. And we're going to first get started here with, during the neurological assessment, we're going to get started with assessing cranial nerves 5 and 7 first. Okay?
Okay.
So with assessing cranial nerve 5, we're going to first begin with sensory function, where I'm going to have Kevin close his eyes. And Kevin, you're just going to tell me, where do you feel, and what do you, I mean, how do you, if you feel the same thing on both sides or either sides or wherever I touch, and where do you feel it? Okay?
Okay.
So,
My right cheek, my left cheek, my right chin, my left chin.
does it feel the same on either side wherever I touch?
Yes, ma'am.
Okay.
My right forehead, the left side of my forehead.
And does that feel the same or does it feel different?
It feels the same.
Okay. So now I'm going to assess the strength of Kevin's masseter muscle. I'm going to have you clench down and bite down on your teeth really hard for me.
Mm-hmm.
Okay. And just assessing for symmetry, observing for symmetry, and just assessing for any abnormalities here. All right. So now, Kevin, I'm going to have you smile really big for me. All right. So here, with the big smile, we're just assessing for symmetry on both sides here, and it's symmetrical. I'm going to have you frown for me. All right. So we're just assessing the nasal lobes and nasal folds here, and just assessing for symmetry there. And then I'm going to have you blow in your cheek really big. All right. Don't let me push down. All right. And then I'm going to have you close your eyes really tight, and don't let me open them up. All right. So all of the cranial nerves 5 and 7 with Kevin seems to be intact. There doesn't seem to be any issues there. I'm going to do the corneal reflex now. As you can see, I'll show you here. I have a cotton tip applicator that I have scratched out a little bit here. And with this corneal reflex, I'm just going to check the reflexes of Kevin's corneal. The corneal reflex consists of me using a cotton tip applicator, where I have a Q-tip here that I have taken the end of the cotton and extended it and twisted around the edges so that I can apply this to Kevin's. I will begin with using this cotton tip applicator to test Kevin's corneal reflex. Open wide for me, Kevin, and just focus on the object straight ahead, okay? Okay. Corneal reflex intact here. Okay, and that's a brisk corneal reflex intact there. Now I'll begin with assessing cranial nerves 8, 9, and 10, and I will begin with doing a whisper test. Kevin, I'm going to have you occlude the left side of your ear.
Okay.
And just take one finger and like close it down and include it here so that you can't hear, okay? All right, so you just tell me what words did I whisper to you.
Dog.
Okay, so I'm going to have you occlude the left side. And you tell me which word did I whisper to you here.
Cat.
Okay. Now we're going to begin with a rhyme test. And this is just testing for air conduction and bone conduction. I'm going to place the end of this tuning fork on Kevin's mastoid process here. And he's just going to let me know what vibrations he feels and how long that he feels the vibration. You tell me when you stop hearing it, okay?
Okay. I stopped hearing it.
Okay, well, what about now? Tell me when you stop.
I start hearing it.
Okay, so bone conduction is greater than air conduction there. And we're going to assess on the side. You tell me when you stop hearing it. Feeling the vibration.
Yes. Okay, I start hearing it.
Okay, now. Tell me when you stop feeling the vibration. Or when you can stop hearing anything.
I start feeling a vibration.
Okay, so bone conduction is greater than air conduction, which is normal here. And now I'm going to do the Weber test, which is just placing this tuning fork on the middle of Kevin's forehead here, and he's going to let me know if he can feel it and where he can feel it and how long. All right, Kevin. So tell me, can you feel it there?
Yeah, I feel it both sides of my head.
Okay, so we have lateral conduction there, so that is normal, and that concludes the assessment of cranial nerves 7, 8, 9, and 10. Now I will begin to assess cranial nerves 9, 10, 11, and 12. We will begin with having Kevin to stick out your tongue for me. All right. And big eyes, stick out your tongue all the way out. There you go. So we're just looking at the oral pharynx, and that seems to be intact there. Good in pink. And now I'm going to assess the spinal accessory muscles here. Kevin, I'm going to push down on your shoulder and just push up against my hand real nice and strong. All right. And then I'm going to have you push your face against my hand here to this side. All right. And don't let me, I'm just going to, I'm assessing the the accessory muscle here. Nice and strong. And then to this way, we'll do the same on this side. There you go. And there you go. And that muscle is there and it's intact. Nice and strong. All right. And now I'm going to assess your mouth again. Cranial nerve 12, where we are just assessing, stick your tongue out. It is symmetrical on both sides. Nice and pink and round, and we're just observing and inspecting the shape of the tongue, the size, and making sure that there's no abnormalities there. Now I will begin with assessing Kevin's biceps, triceps, and brachial reflexes. I will begin by using this arm and supporting Kevin's arm like this, putting one finger here, a few fingers here, well, 2 fingers here. And I'm going to take my applicator here and just tap a little bit here to see if there's any reflex. Briskly tap here to see if there's any reflex here. All right, now Kevin, I'm going to have you, and that's just assessing his biceps. So we're going to have bicep tendon reflex, and we're going to have you sit your arm here, just like that on your lap. All right. So now I'm going to tap here, just to assess for supination of the hand. All right, and there's no supination of the hand. And now I'm going to assess here with Kevin's arm his tricep tendon reflex. And there was no reflexes there. Well, there was no abnormalities there. So that is the quick assessment of Kevin's bicep, tricep, and brachial reflex, tendon reflexes. Now I'm going to continue with assessing Kevin's plantar reflex, Achilles reflex, and his upper and lower motor function abilities. Okay. Now I'm going to begin with assessing Kevin's lower body strength. Kevin, I'm going to push against your knees here and just push against my hands. Okay, good strength. And I'm going to pull against your legs here. Just don't let me pull your legs out. Okay, grab your feet. Push down against my hand. Like you're pressing on the gas. There you go. Okay, good strength there. So Kevin seems to have good upper and lower body strength. There seems to be no abnormalities there. He seems to have good upper body strength where he's able to grasp fully on my hands. He has good strength with lifting up and good strength with his legs, and no issues with any of his reflexes. So now I'm going to begin with testing Kevin's sensation. I will begin now with testing his sensation, his light touch sensation, and then we'll go on to testing Kevin's sensation to dull and to pain. I have a piece of tissue here that I folded, and Kevin, I'm going to have you close your eyes and you just let me know if you can feel the sensation and what does it feel like on both sides, okay? Mm-hmm. And wherever I touch on you. Okay. All right.
My right hand, my left hand, my left finger, my left finger. I mean my right finger. I'm sorry.
Close your eyes.
My right neck, my left neck.
Okay, so his soft touch sensation is all intact. Now I'm going to test his sensation to dull and sharp objects. Okay, so Kevin, this is the dull part of this. Mm-hmm. So I'm going to feel you here. That's dull. And this is sharp. Sure. Okay, so have you close your eyes and you tell me what you feel.
Okay. Sharp, dull, sharp, dull. Sharp, dull, sharp, dull.
Okay, so his sharp and dull, his sharp and dull seems to be intact for the most part here. Okay, lastly, I'm going to test Kevin's proprioception sense and vibration sense, and I'm also going to test Kevin's ability to walk heel to toe, squat, and bend at the knees, and hop on one foot, and we'll go ahead and get started. So, Kevin, I'm going to have you stand up for me. All right, so I'm going to have you walk heel to toe. All right, good job. Now back up to the chair. And then I'm going to have you stand a little bit in front of the chair for me and then bend at your knees like you're doing a squat. Okay. And now I'm going to have you hop on one foot. Good job. Okay. And now I'm going to have you have a seat actually you can sit down. Yeah, you can sit down for this one. So with this hand, go ahead and cover your eyes and close them. All right. So now I'm going to have you just keep your arms to your side. Okay. Okay, so now you can uncover your eyes. So now tell me exactly what you feel that I just did with your arm.
You move my arm in like circular motion, like
Circular motion. So was that a rapid movement or like a slow movement for you?
a slow movement for me.
Okay. And lastly, let's do a vibration test. And I'm just going to use that same tuning fork that I did before.
Okay.
And I'm just going to test your ability to feel the vibration. And you just let me know if you can feel it. Okay? Can you feel the vibration here?
Yes, I can.
Okay. And you can feel the vibration there?
Yes.
Okay. All right. So that concludes our neurological exam. Kevin was a great patient. Thank you, Claflin, and thank you guys for your time.